Today I want to talk about iatrogenesis. So what is iatrogenesis? Well, iatrogenesis is the introduction of disease, other medical malady, or even death as a result of medical intervention itself. So sometimes the things that we are doing to improve health or in an effort to do something has adverse complications that can be very, very fatal. In fact, that there is no such thing as a benign medical intervention. People get hospitalized and contract communicable diseases and potentially succumb to respiratory disease, which had nothing to do with their admitting diagnosis. When we introduce surgery, we introduce risks of anesthesia, we introduce physician error, we introduce sepsis, we introduce other kinds of complications. And drugs themselves have all kinds of side effects. There's no such thing as a drug that is pure and simple without any side effects. Who would ever listen to those commercials on TV, ask your doctor about such and such, and not be totally sensitive to all the disclaimers that exist on those ads? So when we look at our effort to respond to the consumers and have doctors feel that they're doing something, there needs to be much more recognition of the different kinds of adverse complications that are associated with delivering care. In essence, we should be organized around a delivery system and a process that focuses on what I would call optimal health care, which is bringing the patient back to health in the shortest time possible with the least intrusive, most conservative intervention available. In non-emergent situations, this should be our pathway. And only when we exhaust all of these more conservative and least invasive procedures should we introduce the more risky procedures that in fact could have consequences that are very serious to us in our healthcare system. So let us go back to what Hippocrates, the father of medicine, had admonished physicians of his day to do: two things: to heal or at least do no harm. So we need to have a system that is much more sensitized to the various pluses and minuses of procedures that we are introducing to the patient.